Hello, my name is Jasana. I am a BSN student here at the University of North Carolina at Wilmington. I have a background in both public health and in emergency nursing. My first degree was from the University of North Carolina at Charlotte in public health and human science, and I achieved my ADN from Rowan Cabarrus. And I've been emergency room nursing ever since. With that, I have a little bit of a different background than everyone who's straight medicine, and I often try to include the social determinants of health whenever I am examining my patients and trying to come up with a good discharge plan for them. Through this program, I've learned a lot of different strategies to tackle those social determinants of health and figure out ways to implement strategies that result in better health outcomes for my patients. This year especially, I've gotten to see the sides of nursing that I didn't see before, and that's as an advocate. My mother was diagnosed with breast cancer, and my nephew spent some time in the hospital for RSV. With my nephew, he was only 6 weeks old, and he had to be hospitalized to treat his RSV because he was dependent on oxygen for a few days. It was a kind of hard time because as someone who would have been able to kind of help my family with that at home, make sure my sister had everything she needed to take care of him, we were only limited because we didn't have an oxygen tank. So few days in the hospital isn't the best place for a newborn baby and their mom, but because of the lack of resources in my area surrounding telemedicine, we didn't really have a choice. I think if we were able to implement some type of innovative care into that healthcare system for kids, it would have been a much easier environment for both my nephew and for my sister to heal from RSV at home with just monitoring regularly of his oxygen levels and keeping the nasal cannula on his face at all times. We could have utilized the telemedicine for checkups or calling doctors if we needed to, but ultimately we ended up having to spend multiple days in the hospital where everyone's sleep schedule is affected because we often have loud noises and machines that run at all times in the hospital setting. Unfortunately, my mom was also in and out of hospitals a lot this year. She was diagnosed with breast cancer, and with that come many appointments. After surgery, she had a lot of different follow-up appointments just to check up and see how she was feeling. With those, she had a lot of driving, and after surgery, she was very tender in her chest wall area, and driving was more difficult than it was prior to the surgery. Because of this, if I was working, she would have to endure a lot of pain to go to those follow-up appointments. And I feel like a lot of them could have also been telemedicine. Obviously, she had daily in-person radiation, but she would also have checkups with oncology team and post-op team where they were kind of just evaluating how she was feeling. She could have saved herself a lot of pain and discomfort had those checkups been utilizing telemedicine. So as my passion project, I would love if we could start tackling a lot of those social determinants of health, including financial means for people who have to Uber to and from appointments, environmental factors like proximity to hospitals, or even the availability to transfer yourself with lack of transportation in the area. I think using innovative tools like telemedicine would help provide proper health equity to the population and the members of our community who don't have the resources at hand to make it to their daily appointments or to treat themselves at home. With that being said, as a nurse and as a public health background, I think nurses play a huge role in that. We could implement a lot of the telemedicine as triage nurses or as that first line of the defense for patients seeking care at home. By implementing more and more telemedicine, I think that patients would have better health outcomes and also be able to access care at much better rates.